Come in.
Hi, my name's Alana. I'm gonna be your student nurse today. How are you?
Good, how are you?
I'm good. Alright, I'm just gonna wash my hands before we get started, okay? I'm washing my hands and I'm putting on PPE.
I feel so bad. Putting my socks on your hands.
Alright, can I see your wristband? Can you verify your name and date of birth?
Savannah Cooper, August 12th.
Alright, do you have any allergies? Alright, so I'm going to perform an assessment on you. Is that okay? Alright, I'm checking the patient's chart. She has normal vitals and her allergies. She said she has no allergies, and that is correct. Are you feeling any pain today?
Yes.
What kind of pain?
A headache.
Alright, and how long has that been happening?
Since this morning.
And is it like a certain area in your head that it hurts?
Middle of my head.
How long has it been?
Like 2 hours.
Alright, could you describe the pain?
Throbbing.
Throbbing. Is there anything that makes it better?
Tylenol.
Is there anything that makes it worse?
No.
And you said the Tylenol was helping? And
lower your bed rate.
from a scale of 0 to 10, with 0 being the no pain and 10 being the worst pain you ever felt, how would you rate your pain?
4.
A 4? Alright. I'm gonna go ahead and raise your bed up.
Okay.
Alright, so the patient is not showing any signs of distress. Her face looks symmetrical, her body looks symmetrical. Do you know where you are right now?
HCC.
Could you tell me your name
Savannah Cooper.
and the time?
2 o'clock.
Alright, so the patient is alert and oriented. Okay, I'm gonna go ahead and assess your skin, okay? So I'm looking for any lesions, any wounds. Alright, the patient doesn't have any lesions or wounds. The color looks good, the temperature feels normal, and there's no signs of edema. I'm gonna look at her nails. Her nails look good. Alright. That looks good. What else am I doing? The texture feels good. I think everything's good. Correction, I would check for skin turgor. Okay, skin turgor looks good. Okay, I'm gonna be assessing, that was the capillary refill when I squeezed your finger and it was less than 2 seconds. Alright, I'll be assessing your head and your ears and your eyes, nose, mouth. Is that okay? Are you feeling any pain in any of those areas besides your headache?
No.
Alright, so if you turn your head, just looking in her ears, that looks good. Assessing the external ear. Okay, gonna shine a light in her eye. Alright, her pupils are reactive. Okay, could you look at my finger and follow it as I go to your nose? Perfect. Looking in her nose and mouth. Perfect. Can you do a big smile for me? Perfect. So it's symmetrical. Her hair looks good. Scalp looks good. Feeling her head for any abnormalities. That seems good to me. Checking her carotid one side at a time. The rate and rhythm is normal. Okay. I'm gonna go ahead and put the head of your bed up, okay?
Hi, my name is Randy Longe, and I'm going to be your student nurse for today. We're going to take a physical assessment. I'm going to perform hand hygiene before I start. Now, can I see your wrist?
Alright, so her chest looks good. Are you feeling any chest pain?
And your date of birth?
Do you have any pain when you're breathing?
And
do you have a
any
cough?
allergies?
No.
Okay, so I'm assessing her chest. She does not seem to be
so I'm going to
breathing.
start off with the
She has
vital
no
signs.
labored
I'm
breathing.
going to-
She's using her accessory
What I'm going to
muscles
do is
well.
I'm going to take
Everything
your
looks
pulse,
good. Alright,
your
I'm gonna take a
oxygen,
listen
saturation, your
to your
respiratory rate, your blood
respirations.
pressure, and your temperature.
Okay, so just take a
And I
deep
will
breath
also
every
take
time
your
you feel
pain
the stethoscope move, okay?
Okay, so her pulse is normal. So her pulse, oxygen saturation, respiratory rate, blood pressure, and temperature are all normal. Do you have any pain in any of your body systems? No. Alright. And if she did have pain, the questions that I would ask is, when did it start? Where is the pain? How long has she been
Alright.
experiencing this pain?
That
What
looks
is the
good. Can you just
quality
lean
that she
forward
can
for me?
And what makes the pain
Alright, I
worse?
don't know
What
why I
makes the
took this
pain
off.
better? The treatments that she took for the pain,
Okay.
as well as the severity.
Go ahead and take a deep breath every time you
Now
feel
I'm
the
going to
stethoscope
assess
move.
her level of consciousness by asking her questions. Looking at her general appearance, she seems to be well maintained. Her hair is done nicely. She looks like she's keeping up good hygiene.
Thank you.
There doesn't seem to be any signs of distress, and her body parts look symmetrical. So what is your, sorry, I need to change these questions. So do you know where you are right now?
Yeah.
All right. Where are you right now?
I think like.
Alright, perfect. You can go ahead and lay back down.
Where do you think you are right now?
Correction, I would close her curtain for privacy
Yeah.
at the beginning of my skill.
Okay.
Okay, so her, the
Do you know
rate
what
and
date it is
rhythm of
today?
her breathing was normal. I didn't hear any abnormal breath sounds and the depth seemed good to me. Alright, so next I'm going to be assessing your heart, okay? Do you have any chest pain?
No.
Alright.
All right, that's correct. And who is the president right now?
Okay, so I'm going to start at her pulmonary, or her aortic, my bad.
Okay, that seems good. Next,
Moving
what I'm
over
going
to
to do
the
is that I'm going to check all
pulmonary.
the equipment around the bedside. I'm going to make sure
Alright, and then
that
herbs
there is
point,
no kinks in the tubing.
and then
There is no skin
tricuspid,
breakdown wherever there is
and
tube replacement,
mitral.
and that the canaliculi is placed properly.
Alright,
also make
seems
sure that there are no
normal to
kinks
me,
in
and I would
alveoli
listen to
tubing,
the
and it's
mitral,
hanging in the specific proper spot.
for 60 seconds.
I will
and
also check
radial
the
for,
catheter, if the catheter is
30.
placed properly,
Her
and
pulse
look for
sounded
skin
normal, the
breakdown
rate and
around
rhythm
the
was
insertion
normal, and I didn't hear any
site. Looking
abnormal
at
heart sounds.
her, fully catheter
Alright,
bag, I can see
so
that the
next
color
I'm
of
gonna
the
push your
urine
bed
is
down
a
so I can
normal
assess your
yellowish
abdomen,
color.
okay?
It seems to be a regular consistency, and the amount is normal.
Are you
Okay,
having
so
any
next what I'm
stomach
gonna do
pain?
is that I'm going
No.
to assess
Do you
your
have any
skin,
nausea,
nails,
vomiting,
and hair.
diarrhea?
No.
When was your last bowel
Looking at her
movement?
skin,
Yesterday.
and
Was it
for a woman of
normal?
her top,
Yes.
she seems to have regular skin.
Alright, I'm just taking a look. The size and shape looks
Very
good. The
racist.
color
So
looks
her
good.
skin
I don't
seems
see
to
any
be really nice and pink
pulsations.
on areas where they're
Okay,
supposed to be
I'm
pink.
gonna take a listen to your bowel sounds, okay?
I don't see any rashes or lesions anywhere. Can I inspect your hair? Alright. Her hair seems to be evenly distributed. There seems to be no color changes. And I don't see anything in there. No lights. And it seems normal.
Okay. I would listen to her bowel sounds for a total of 30 seconds. If I couldn't
Now,
hear
can I
any
help
bowel
you
sounds,
for
I would
skin
listen in
sugar?
each
I'm going to
quadrant
basically pinch
for about
the
4
skin
minutes. Okay, I'm
on
gonna
your
start pressing on your stomach, okay?
Are
Are you having any
on your
pain when I
chest?
touch?
And assess the elasticity.
Okay, her
of
stomach
your
does
skin.
not feel rigid. I don't feel any abnormalities. I'm gonna percuss.
Can I check your fingernails for
Okay,
capillary
everything
refill?
sounds normal, and feels normal.
The color returns
Okay.
to
Oh, and
fingernails
correction, I would
within
check
3
for
seconds,
equipment. She
so
did not have
it's
any
normal.
urinary drainage
The texture of
bags
her
or
skin was nice and
IVs or a
smooth. It
nasal
seems
cannula.
nice
I
and
would have done that at the
hydrated.
beginning. Okay.
Your temperature
And do you have any how often do you
temperature
urinate?
is normal.
Multiple times a day.
Yeah,
When's the
because
last
cells
time
are
that you
temperature.
did?
It says for palpate,
This
skin
morning.
trigger.
Did it
texture,
hurt? Did you have any
temperature,
burning
and
sensation?
No.
And was
I
the
don't
color
see
normal?
Any swelling from
Okay.
edema on any of the limbs.
Do you have any pain or
did you
tingling
have the
or
pain?
numbness in your extremities, like your arms or legs?
And I
Okay.
can't see any edema.
Her hand, the color looks good. I'm gonna check her radial pulse.
And there is no pitting edema.
Okay, and the other one.
There is no wounds on her, but if there
Alright.
was, I would assess the wounds for appearance, size, dressing,
Checking
drainage,
the ones by her
if
ankle
it drains or not, and what type of color
and
the
the
drainage
top of her
is.
foot.
I already did capillary refill.
Alright,
Okay, now I'm going
perfect.
to inspect
Okay,
your
so could you
ears.
hold my hands and give them a big squeeze?
I'm gonna look at her
Perfect.
external ear,
Go ahead and push against my
everything
hands.
looks normal.
Okay, and pull up. Perfect. Let me move the camera because I don't think you can see it.
And can I check
Do a little turny
to
turn.
see if there's any lesions
Okay,
between
can you
the
push against my hands?
Okay, there doesn't seem to
And
be
try to
any
pull up.
lesions.
Perfect. Okay. Would you like the head of your bed down or?
So I'm gonna check for her eyes. Check her
Okay.
eyes.
Would you like the head of your bed down or up is down okay?
Down's okay.
If
Okay,
they're
I'm gonna
black
push
and
your
white,
bed down.
they're accommodating. So
Okay. Here's your call light. Do you know how to use it?
Yes.
All right. Do you need anything else from me?
Nope.
Okay. I'll be back to check on you in a little bit. Okay.
Okay.
And I will
her
remove my
pupils seem to be
gloves.
accommodating to the light and reactive to the light.
Throw it away in my pretend trash can. Do hand hygiene and leave the room. And then I'm done with my skull.
Okay.